Hello, welcome to TV Agro. My name is Gabriel Rojo. I am a veterinarian and medical director of the Autovet Veterinary Clinic, and today we are going to talk about bad breath in our pets. Other pets really is a reason for consultation in our clinic. Many consultations a day come to us wanting to arrive because the pet has a strong breath, and that really can be strong breath, and that really can be a cause of being a rejection or avoid an approach with the pet. And why it can happen are usually due to periodontal diseases, the main cause, but there can also be due to diseases of the cause. But they can also exist for diseases of other organs that are reflected in the breath. But then let's talk about periodontal diseases. Periodontal diseases, which are inflammation of the periodontal disease, is the combination of several symptoms such as gingivitis or some type of purulent secretion of the gums. There can also be inflammation of the tongue of the pharynx and this combination makes them have periodontal diseases. The accumulation of tartar on the teeth of dental plaque on the teeth causes a very high bacterial load and causes bad breath. So generally we also have to take into account the oral hygiene of our pets. I know it is not easy. Some patients do not allow them to brush their teeth once a day or at least 3 times a day or at least 3 times a day, at least 3 times a week. However, some patients, both cats and dogs, do not allow it. I know that it is not easy. Some patients do not allow it, some cats and dogs do not allow it, because they are fierce, because they do not like it, and generally this happens because we do not accustom them since they are very young to have this type of routines. So an initial recommendation is to teach all puppies to brush their teeth so that they will allow it to be a friendly process so that they will be able to brush their teeth. We have a routine that we have at home to prevent diseases such as periodontal disease, which I will tell you later what causes it can have. So on the one hand, it is also very important the type of food we give to our pets. From that also derive periodontal diseases. It has been proven that soft foods generate or accelerate the process of periodontal disease compared to solid foods such as concentrate. So for example, soft diets can form tartar, gingivitis faster in our patients. All this leads to bad breath then, that is to take into account, and there is a breed that are also more predisposed to suffer from periodontal disease, is that other generally small breeds such as the George Sahii Terrier known Yorkshire and the French Poodle the Pinscher are patient or very predisposed breeds to suffer from periodontal disease. For 2 reasons. 1, because generally the little ones do not allow themselves to brush their teeth very well. Another reason is because they have a low appetite and generally one ends up giving them soft foods such as chicken, such as rice. 3, the anatomy of their mouth is different. The teeth are closer to each other and they store food, and that accelerates the process of the diets of large breeds like the German Shepherd or the Golden. The teeth are a little bit more separated, not allowing the food to be stored in the mouth. This is a point in favor for them, but it does not mean that the large breed dogs do not get sick. But of course they do get sick. Of course they need dental prophylaxis, but they are less prone than the small breeds. So in order for them to have a point in favor is that type of thing that you have to do to know if my dog has a periodontal disease is not basically to bring her here to the veterinarian so that they do exams to see that she does not have gingivitis, that there is no accumulation of tartar and plaque, veterinarian, so that they make examinations to see that it does not have gingivitis, that there is no accumulation of tartar and plaque, that it does not have fractured dental pieces, that its cheeks or its pharyngeal part, all this. Let's say that between the normal, if there is presence periodontal disease, a method of treatment is the dental prophylaxis. Then in what consists dental prophylaxis here is not really a process that we do under anesthesia. We use ultrasound equipment to remove all the plaque and tartar that you have on your teeth, lowering the bacterial load, and also that makes the bad breath go away. Obviously, unfortunately, it is not a treatment or it is not a procedure that is for life, because it also depends on the type of treatment that you are going to have. It also depends if we brush the teeth. the type of food, everything he mentions, but it is a treatment that has to be done. Many owners are afraid of the anesthesia process and there are risks, but they are very minimal. It is a very simple procedure, but they are very minimal. It is a procedure that is relatively short, we can take depending on the case, but between half an hour to an hour is also a case that when we do not do exodontia is a procedure that when we do not do exodontia does not involve a deep anesthesia as to make an orthopedic surgery. To give an example here in Autovet, not anesthetize patients if we do not have a pre-anesthetic tests where we looked at the renal functionality is fine, that they do not have anemia, that the platelets are fine, and all this to minimize since they do not know also that we do in your patients we put them in a team in is signed with oxygen with multi-parameters and where we have a little more monitored and controlled in the case that it comes to pass some kind of alteration in the case that the patient has an anesthetic. It is a procedure that has to be done routinely. It is a procedure that we recommend the same as we do when we go to the dentist and they tell us to go every 6 times or at least once a year. It is basically the same for them. So that is what we have to do to prevent our pet from having bad breath. Our pet from having bad breath have good toothbrushing habits. Provide good food sources, and you can do prophylaxis periodically. In some patients we get in advanced ages where they have never done a prophylaxis and they arrive without teeth with abscesses in our molars. And they can even get to have perforations of the skull by chronic abscesses and we end up doing exodontia s almost all their pieces and you are going to be left without teeth, and that is not at all, and that is not good. So as a recommendation is to do that type of periodic prophylaxis. Toothbrushing is very important for patients who are aggressive. There is a product where they are applied in the water so that they drink and somehow it helps so that they have it very much in mind. And the other type of bad breath that is not derived from dental disease but from other diseases. It is necessary to keep them very much in mind. There are renal diseases. There are hormonal or electrolyte diseases that can cause bad breath. Usually, when patients have a fairly strong renal failure they have an ammonia odor in their breath, so it is a point to take into account other products that can help us for the oral care of our patients as well. In some types of snacks there are some snacks that consist of them biting in a routine way really to make as toys for them, and that mechanically causes a cleaning in their teeth, and also some snacks or toys so to speak bring some kind of additives or substances that help us to remove. Also some snacks or toys so to speak bring some kind of additives or substances that help us to eliminate the plaque and tartar that is on their teeth, and therefore that also helps us to improve their bad breath a lot. We must be very careful because some owners know that there are some kind of antibiotics that can be given to them to improve bad breath. But that is not really the way to treat them. The way to treat them really supplies the antibiotics and they can improve the bad breath, but they are not eradicating the problem that is tartar and plaque. So please be very cautious with the use of antibiotics in a discriminate way, because we can cause or help the bacterial resistance that nowadays the bacteria are having when weighing the antibiotics. So we must be very cautious with this kind of antibiotic uses in a discriminate way, because we can cause or help the bacterial resistance that nowadays the bacteria are having when weighing the antibiotics. So we must be very cautious with. We have seen that they are done without anesthesia because there are patients that need it, patients with high aggressiveness, very restless and anxious patients, because they will allow us to clean their molars in a routine way. Remember that prophylaxis is not only to look at the teeth, we also have to look at their tongue. We also check their cheeks, we also check part of the pharynx, to see that there is no type of alteration, such as masses or severe inflammatory process. Then we do it under anesthesia is basically for that reason, because they leave us a manipulation. Much better if there is a need to do an anesthesia. If it is necessary to perform an exodontia on any dental piece or any type of dental treatment on any dental piece that generates pain, it will not allow us to perform this type of procedure, nor will it allow us in most cases to perform a complete physical examination. Therefore, we do it with the patient under anesthesia, taking many precautions and care, and with the monitoring that all types of anesthesia require. There are some types of home remedies that some owners really use because from my point of view I don't recommend it, because some types can cause some important alterations like intoxications. Then we have said that some owners use bicarbonate, some owners use some type of natural ingredient, but that can intoxicate the patient. Then from my point of view I do not use them. I have seen that some doctors use some homemade tips that can get to work, but really my recommendation that are to avoid them. Bad breath, or to eradicate the bad breath of our pets, is prophylaxis. The routine brushing of teeth of our pets use products that come to apply in the water that they drink and help us enough to avoid bad breath, and avoid that we accumulate plaque on the teeth of pets, and another equal, let's say with the help of snacks or toys for the care of the teeth, is a very good help for that. And the recommendation is always, if you notice a strong breath in your pet, bring it to the veterinarian. Your pet, bring him to the veterinarian to do a checkup on their teeth and their oral cavity and determine towards the treatment that is best for your pet. Thank you very much. Remember not to follow us on our social networks and Nothing Auto Vet, and all the doctors are here to help you with any written questions or doubts you may have.